Hello, my name is Shabri Bailey, and this is my final presentation for course BHS271, and this is called Understanding Autism Spectrum Disorder, also known as ASD. So, what is ASD? So, autism spectrum disorder is a neurodevelopmental condition that affects how a person communicates, interacts socially, and experiences the world. So, the spectrum part of that is because individuals with ASD can have a wide range of strengths and challenges. Some individuals may be able to live independently. They also will have the strong verbal skills and intellectual skills, be able to do things on a daily basis alone with maybe a little bit of support. But then there are some individuals who may need significant support daily. So it just depends on the level of severity. So there's level 1, 2, and 3. Level 1, may struggle in social situations. So they may need maybe some therapy support, or understanding social situations a little bit better, practice there. But then level 3 severity, they may be nonverbal, or need assistance to manage daily tasks as they aren't able to manage those alone. So not one case of ASD is like another, and everyone is unique in their strengths and challenges. So, common signs, causes, and risk factors of ASD. So, typically, common signs would be limited eye contact or difficulty reading facial expressions, which comes in with the limited interest in social interactions or playing with others. They may just struggle in those areas. So they may just need to be taught, how to interact with other people, other peers, other children, other adults, depending on what their age group is. And then they also may have delayed speech, need for strong routines, difficult with change, sensory light sounds, textures. They may not like bright lights, loud noises. So some things in the environment can be altered just to make sure that they feel as comfortable as possible. So causes of ASD, it's kind of unknown completely, but there are some general causes that could possibly be, which would be genetic factors. Autism does run in families, and potential air pollution, complications during pregnancy. But it is important to note that vaccines do not cause autism, and this has been disproven scientifically as well. But then risk factors for ASD would kind of be similar. So genetic conditions, Fragile X syndrome, if a parent is older, but especially if the paternal parent is older, and then a maternal illness or complications as well, exposure to environment. It just kind of all depends on the individual. ASD prognosis and daily life implications. So prognosis, ASD, people that live with ASD, it is a lifelong neurodevelopmental condition. So unfortunately, there is no cure. However, early intervention, which does start before the age 5, can greatly improve outcomes. And some individuals may end up developing strong communication and adaptive skills over time, just kind of depending on the severity and co-occurring conditions, which could include other mental health conditions or physical health conditions that they may also be dealing with that could hinder their process or just make it a little bit difficult, more difficult. So daily life implications. So they do have challenges with social skills, communication, emotional regulations, especially when they're dealing, with their sensory sensitivity. They may have a difficult time regulating their emotions, especially when they feel that discomfort. They do benefit from structured routines, predictable environments. I did have a kid that I worked with who was living with autism, and what we did is because he felt he was a little bit uncomfortable with the fact that he didn't know when things were going to happen. So we would set timers for him so that he can kind of predict a little bit more when things like different, when we would do certain things like go outside or start dinner or things like that. We would time those things so he felt that he more comfortable, and behaviors did also improve there. And then with the right support, though, many definitely live meaningful, happy lives like everyone else. So understanding the ASD diagnostic process. So typically, people with ASD can be diagnosed as early as 12 to 18 months, but usually most children are diagnosed between 2 and 3 years old. Some children may not be diagnosed until much later because they may have milder symptoms that may not be noticed, especially from family members. But early intervention does allow, or early diagnosis definitely allows a more timely intervention and enough time to receive the support that they may need. So who diagnoses ASD? So developmental pediatricians, child psychologists or neuropsychologists, and then child adolescent psychiatrists as well. And common diagnostic tools. So definitely the DSM-5 criteria is used, as well as other screening tools like the Autism screening tool for toddlers, interactive play-based tool. So that looks like more of an observation. They do have gold standard observation, which is kind of observation structure. And then just different questionnaires as well to determine a diagnosis. The prevalency of ASD. So overall, 1 in 36 children in the United States was diagnosed with ASD, according to the CDC in 2024. Most commonly, boys are diagnosed than girls. A 4-to-1 ratio. There are differences, racial and ethnically, between diagnoses, as well as because of the increased awareness and identification. This has led to an improved diagnostics tools and just more diagnosis in general. So this kind of lists some quick stats here for autism diagnosis. So school eligibility for individuals ASD. So they are eligible under IDEA to be able to receive support, especially if ASD, autism, affects educational performance. So an early intervention services like occupational therapy is offered. Special education services will work with the disability services to create a IEP, which is an individualized education plan. And then school age children will also use that IEP throughout their school. There are some students that may not qualify for IEP, so a 504 plan would be needed to get accommodations if they are needed as well. And here are just some resources, local resources for people in Phoenix that have autism. And then here are some local numbers that you could reach out to in Phoenix to get assistance. Thank you so much for watching this presentation on autism, and I hope this information was helpful, and I am glad to be done this semester. Thank you.